Comprehensive Center for Brain Health was created to allow us to take what's called a transdisciplinary approach, taking specialists from many, many different fields and breaking down the usual walls or barriers that pigeonhole researchers, and working as a team to understand what constitutes healthy brain aging and what puts people from diverse backgrounds at different risk for developing diseases like Alzheimer's disease. We developed a group of tools which we call the Brain Health Platform. So this allows us to look at resilience factors, what makes the brain stronger, vulnerability factors, what makes the brain weaker, and performance, which tells us how someone's doing at that moment in time. Then we can look at an individual, look at those individual factors that are putting them at higher or lower risk, and develop a personalized plan to address it. And I think that's really the key, because one size fits all really fits no one. But if I know everything about that person, then I can tailor those recommendations specifically to that individual.
That's okay. Walk at your normal pace as you normally walk in the streets to that blue line and then come back.
We created a study called the Healthy Brain Initiative. We do a bunch of medical testing. We share some of the results back with individuals so they have feedback on this, and then we ask them to come back every year. Our goal is to recruit about 500 people and follow them over time, and we're really trying to focus on having a diverse sample. We're trying to understand how women with certain genetic traits may progress faster than women without those traits and faster than men. We're trying to understand what are some of the underlying differences between how African Americans perform on test and other groups perform on test. We are trying to develop some novel markers that can tell us what puts people at risk. These include things like how people speak, their pattern of speech, how their eyes track objects in space, and how they stand and walk. And we're using techniques called machine learning, which is sort of like artificial intelligence, using the information, whether the machine can pick out who has disease and who doesn't. And these markers appear to be very powerful early detectors of people at risk for disease.
Place your chin here. Yep.
Participants are invited to come to the center. They're usually here for about 4 hours. When they come, we go through the lab work. Once labs are completed, then we begin with memory assessments. Some are pen and paper, others are computer-based. Then they are met with the research clinician who will do a very thorough physical function assessment. They have them walk in a digital mat. And for example, one of the exercises that they do is they have to say the alphabet backwards as they're walking. So they're using their executive function. We also have an in-body machine that not only tells us what their BMI is, but also can tell us a little bit more if there's any muscle mass, things that we can maybe work on.
I think that one of the most exciting things about this program is all the tests that are conducted and the information that's given back to me. I find it very interesting. I like getting that information, and then I can share with my primary care physician if there's any concerns.
They're given the opportunity to get these assessments that typically they normally would not get. We also have retina screening. So the retina can actually tell us a lot of what might be going on in the brain in terms of amyloid plaque.
I think that what I've learned is it's helped me quell any fears that I have, that I do have a significant memory loss. You know, I forget names, I forget things, but you know, at my age, I think that's kind of normal. So that's been good. That's been good, a positive thing.
At the end of the visit, everybody sits with a clinician who gives them feedback on how they did, what we think is going on with their brain health, and then recommendations to improve your brain health. And what we find is the people who follow those recommendations, they tend to actually show a little bit of improvement from year to year. The people who don't follow those recommendations tend not to show much improvement. So clearly, these type of interventions can make a difference.
You ready? You ready?
I work in recruiting Latino communities as well as African American communities, communities of color. There's a stigma that lies around dementia, even the word dementia itself. So my work is to educate, help them understand that there's nothing to be afraid of, that they're going to be contributing to something that's going to help them and eventually help other members in the community.
Thursday, Wednesday, Tuesday, Monday. Our bodies are made to move. We have a brain that we don't use half of, so I try to read. I love reading. And I also write.
So you're gonna use only this wheel, okay? And then you're gonna stay on the right dogs first, if you can.
Geraldine has been active in her research studies for a number of years, so there's a personal connection that's very important to Geraldine. Her mom passed away from the disease, and her sister recently received a diagnosis of Alzheimer's. So as a female and an African American, this is very important for her to participate and give back to the research community, and also really to empower her own community that it's important to get checked and find what the baseline is.
I'm hoping to learn anything that may signal where I need help. No one wants Alzheimer's. I don't want it, and I would do what I can to help them find a cure for it.
When we have conversations as physicians and healthcare providers, we often focus on, disease and disability and death, and we talk very little about health and capability and vitality. Right? So what we're trying to do is sort of change the topic of conversation. Instead of talking reactively to a disease that's already happened, let's talk proactively to potentially prevent a disease from developing. Let's not focus on things like life expectancy, that's life lived long. Let's focus on health expectancy, which is life lived well. And I think that's what makes our project very, very different than what most people are doing. When you walk in, it doesn't say Alzheimer clinic, it doesn't say memory disorder clinic, it says brain health. And that's the focus. We want to find out what your risk is, what we can do about it, because we want to make you the best you that you can be.